Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
There's been some studies looking at how childhood experiences of trauma affect migraine later in life, but that hasn't really been looked at within LGBTQ individuals. And so this was a step towards understanding that connection a little bit more clearly.
Welcome to Talking Head Pain, the podcast that confronts head pain head on. Hi, I'm Joe Coe, Director of Education Digital Strategy at the Global Healthy Living Foundation and a migraine patient for over 20 years. I'm here today with Dr. Rosendale, who is the principal investigator of a study called Migraine Disability, Trauma and Discrimination in Sexual and Gender Minority Individuals. I know that's a mouthful, but we'll break it down so you understand why it is important to you. It's important to note that this research was conducted through the PRIDE study, which is a large-scale, long-term national health study of people who identify as lesbian, gay, bisexual, transgender, queer, or other sexual or gender minority. So Dr. Rosendale, thank you so much for being on Talking Head Pain. I'm so looking forward to this discussion.
Thank you for having me. I'm delighted to be here.
I don't want to bury the lead. What do you think is the most important thing that people should know from this research that you just conducted?
So the great thing about this study is it's really one of the first investigations looking exclusively at migraine and the experiences of LGBTQ plus individuals who have migraine headache. And so we've found that, not surprisingly, migraine is common, as it is in other individuals as well. And we've identified some really interesting differences in kind of care experiences and potential barriers to accessing care for migraine headache in the community that I think are good for all of us to know about.
I so agree. When I saw this study, and it was actually passed along to me from my Pride Center that knows that I do this podcast, that I live with migraine, that I'm an activist in our community, and said, you should know this. And I said, we might have a connection to this study network. And here we are today. It's a really important issue. I want to know what you think migraine patients and or the LGBT community should know about this research in particular. How does it impact our lives?
Well, I think there's a couple of aspects of this research that really highlighted and kind of emphasized things that we may have peripherally known, but now we kind of know it with more security or more we know it a little bit more definitively, if you will. One of the things is that social stressors and experiences of discrimination as folks navigate their life affect migraine severity and disability and frequency. And so that is something that has been looked at in other communities, particularly predominantly cisgender women. There's been some studies looking at how childhood experiences of trauma affect migraine later in life, but that hasn't really been looked at within LGBTQ individuals. And so this was a step towards understanding that connection a little bit more clearly. The other piece of this that I think is really important is that an aspect of this study that we looked at was really access to care and kind of what kind of care folks with migraine were receiving. And one thing that arose out of that was there are certain barriers that people access, and there are, not everyone who had migraine headache who was interested in seeing a neurologist for their headache had access to that, right? And when we looked at specifically what medications people were using for migraine, there were some interesting trends that we saw in a lot of people using kind of over-the-counter medications or using more of the natural remedies like riboflavin and magnesium rather than using more pharmaceutical treatments. And so I think that that's just a piece for folks who are experiencing migraine to really understand, whether you're LGBTQ or not, is really how to advocate for yourself and how to advocate and ensure that you're getting access to specialist care if that's what you would like and if that's what you need. And also that within that, there are opportunities for access to newer medications or potentially more efficacious medications to help reduce the impact that migraine has on day-to-day life, because migraine is quite disabling and it can be a big component of how people live and change how people function.
And did you see a difference between, or did you even get to look at the difference between episodic and chronic migraine patients?
So interestingly, when we looked at the distinction between episodic and chronic, and really that breakdown is, 15 headache days per month is the barrier or the kind of the definition of chronic migraine, we didn't actually see a significant difference between folks who were experiencing episodic versus chronic migraine. When we looked again at that kind of intersection between experiences of trauma and discrimination, we didn't break down the sample into, or kind of the participants into folks who were experiencing episodic migraine versus chronic migraine. We really just kind of looked at all comers with migraine. And part of that was just statistically in terms of the grouping and making sure that we had enough people in the different groups that we could kind of look at overall trends. I certainly think that this is just a start to the research. There's more that needs to be done in this question and in this community. So hopefully this will just start generating more and more questions for folks to research later.
It is so exciting to me. I've been asking for stuff like this for about 6 or 7 years. I go to medical conferences. I was like, where are the LGBTQ neurologists and practitioners? And where is this happening? And when I saw this, my eyes lit up and I had to speak to you. I'm curious about how you and your fellow researchers define trauma, because that's kind of a very loaded word and it means something different to so many different people. So it might be helpful to understand how you define trauma.
Absolutely. So for this particular study, it was a very broad definition, and we somewhat arbitrarily, I kind of acknowledged, dichotomized between what we labeled as trauma in the study itself, which was experiences of essentially physical violence, sexual assault, experiences similar to that. And we looked also at experiences of discrimination, so unequal treatment in accessing services, harassment in public, barriers to accessing education, employment, et cetera. And I will fully acknowledge that this is, again, just the start to this conversation. I think there's more work definitely to be done in diving into this a little bit more. And some of where this broad definition and kind of how inclusive we were in terms of what we looked at came from is really what had been used in the PRIDE study and what's continuing to be used kind of within the cohort. That's also undergoing refinement. So we actually collected our data in 2018 for this study that just got published. And so since that time, there's been kind of other iterations of this definition and how this is being discussed and looked at within the PRIDE study. So as with everything in medicine, there is kind of ongoing understanding and more nuancing. But I will say that I think to some extent, there was a benefit in keeping it broad because there is a difference in experience, but that doesn't necessarily mean that just because folks don't experience a more violent type of trauma, that's not affecting their health and that's not affecting their migraine and vice versa. So I do actually think that it was useful in some way, particularly because this is kind of the first step into understanding this question and this interaction between these experiences and migraine, that really keeping it broad allowed us to kind of open up the field for other questions and other researchers, hopefully, to kind of step into this space and really drill down a little bit more on what's driving that, how we can help, and other kind of mechanistic connections between these experiences and then migraine and migraine disability.
I totally agree. And I am not a researcher, so I could say this as a non-researcher, as a member of the community, and as a migraine patient. Trauma and how we define it, macro, microaggressions, however we want to look at it, we really don't know how it really impacts us on a deep level. And I think studies like this are so important because it brings it into the public discourse. It brings this idea that, adverse childhood events, which we know are studied in many different ways, in many different areas, impact our community. And I always had a personal theory that it increased my migraine intensity and sped up my predisposition to having migraine. But of course, I'm an N of 1, and there hasn't been much formalized studies around that. So seeing this is so exciting, and it leads me to my next question, that it's so important that leaders in the field, such as yourself, push this type of research and engage in it. Why did you become a neurologist, and why is this your passion?
Such a good question. So for me, I was amazed by neurology as a field, and then also just so grateful for the experiences that I had in my training in working with my patients with neurologic illnesses, that it just drew me in. So I was actually a literature major in undergrad. And so I feel like I've always kind of had this sense of questioning who we are and how society shapes us and influences us. And so within that, neurology just drew me in, right? It's the study of such a large component of what makes us human and what makes us who we are as people. So interesting to me. And then I think this research in particular, as a member of the community myself, I felt like it was very important to infuse activism and social justice and health equity for the community into my work. When I entered the field, there wasn't a lot of kind of understanding of why it was important in neurology, and there wasn't a lot of neurologists kind of working in this space. And so really, I've had the privilege to start blazing that trail of kind of arguing for why this is important and why this community needs to be on the radar for neurologists. And as part of that, I think doing research is really important so that we can add some of this objective data, right? Some of the numbers that might convince people who may not see that connection, and helping them to make that connection in their clinical practice. So I think for me, the research piece of things is really important, again, from that advocacy standpoint, to give us the information of what our patients are experiencing, what the needs of the community are, so that we can really be thoughtful and scientific as we go forward in how to improve neurologic health for LGBTQ individuals.
So would it be fair to say that patient-reported outcome research like this is important part of activism in both the chronic disease community and the LGBTQ plus community?
I absolutely think that's very reasonable to say. Many times within our work as clinicians, our goal is to help the person live as healthy of a life as they can. And one of the really important pieces of that, particularly within neurology, is really looking at function. How does what the person is experiencing, how does that affect their day-to-day function, their ability to work, their relationships, their interactions? And so we're not going to get that from different types of research other than kind of having the patient reported outcomes, right? Like that's a very important piece of what needs to be focused on and a kind of reasonable outcome to look at. And then also I think within the LGBTQ community, it gives folks a voice in what is important to them, how this is affecting their life. And that's often not been something that the LGBTQ community has been empowered to do or had the opportunity to do within the healthcare system. That is certainly changing, and that's fantastic that it's changing. And so I'm really honored to be part of that movement to really focus on what the needs of the community are and then tailoring how we can provide care to try to meet those needs.
Amazing. And I so agree and commend that work. And it's super important. So we touched a lot on how this impacts patients and what it means for patients, both that are LGBTQ and have migraine, and obviously the intersection of both of those identities. How can this research help your peers, your other healthcare providers and or researchers better address health disparities?
Such an important question. I think one of the big pieces of that is really just highlighting that the LGBTQ community is a community in need of further research and is in need of, attention within this space, that there are experiences that may be different from other communities that folks are caring for. And so just to practice kind of open-minded, inclusive questions, really kind of asking about someone's life experience and what they have experienced, what they're currently experiencing, and understanding how that interplays with their migraine, I think is very important. The other piece that I think is important for my fellow neurologists is really just thinking about the importance of mental health, which I think many folks who are caring for people with migraine also understand on a larger context, but this just helps to emphasize that connection. It's definitely something that came through powerfully in this study as being an important component of migraine-related disability. And I think as challenging as it can sometimes be to connect folks to mental health services, it is very important. And so I think that that's another piece of this study that came through.
Definitely. And there's so much to be done on mental health and really, particularly with the LGBT community, getting people that aren't going to be damaging when you do go to a clinician, and that clinician patient relationship and match is really hard and is an art. It leads me to one of my last questions. What's next? What other questions arose from this research? What are you thinking about after doing it?
Such a good question. And there are so many, so many directions to go. I think one of the pieces that really deserves a bit more of attention in and of itself is really this question of access to care and quality of care within migraine treatment for LGBTQ individuals. That was a piece that we had included in this study, but unfortunately, we couldn't dive as deeply into it just because of the nature of the questionnaire was already quite long. And, the more questions we asked, the longer someone would need to take the studies. And we wanted to be mindful of that. So I think that there are a number of questions in terms of that access to care piece that really deserve its own study and its own kind of separate attention, whether that is through more qualitative methods. So kind of interviewing folks who are part of the community and have migraine about what their care experiences are like, any barriers or facilitators of care, because I think that those are equally important to identify, or whether it's more kind of mixed methods and looking at kind of a combination of more of those qualitative experiences and those kinds of responses, in addition to more validated scales that can be compared to other groups and other communities. So that I think is an important piece. And then, as we talked about earlier in the interview, really driving down on the question of trauma and discrimination. One of the kind of questions that we played with a little bit in this study was really thinking about more of this idea of cumulative effect of these experiences over someone's life. We weren't able to address that specifically in our study. It just wasn't designed for this way, or to answer that question. But that I think is really intriguing to me. And again, kind of harking back to the research that's already been done in other communities, thinking about adverse childhood experiences, thinking about, how our early life or even our prior experiences or experiencing discrimination over a longer period of time, how that manifests in the body, and in particular in migraine, I think is a really interesting question. And so there was a signal towards that being something that would be important to look at in our study. We actually, as a what we call a sensitivity analysis, so just kind of exploring a question, if you will, we did look at kind of the number of different experiences that someone reported. So how many different types of trauma and discrimination they reported, and looked at that association with migraine disability. And there did seem to be a signal that the more number, or the higher the number, the higher the association with, or that there was an association with migraine disability. And so I think that that's kind of an intriguing direction going forward, is looking at that more cumulative effect and seeing how that actually plays out in LGBTQ individuals with migraine.
Wow, people can't see, but I actually got chills listening to you say that, because it's such, for those of us that have this lived experience, it's so validating to hear that there is a connection, that it's not in our head, and that there are folks like you that are pushing the boundary here in really smart ways to advance health and wellness. I so appreciate your work. We at GHLF appreciate your work, and hope to support it and amplify it in the ways that we can.
Absolutely. Thank you so much.
Is there anything that I didn't ask that you wanted me to ask?
I think we've talked a lot about some of the most important pieces of the work and kind of directions forward. I think the other aspect of a kind of another direction forward that would be really intriguing too is, again, kind of thinking of this intersectional approach, right? You were just mentioning how there's a lot of different silos of this research happening. And I think the next frontier is really trying to understand how an individual comes to the healthcare system, or comes into and kind of lives their life holding all of the various identities that they have, right? So not only just focusing on sexual orientation, gender identity, gender expression, but also how their race, their socioeconomic status, their, access to housing or not, and how all of those kind of piece together, I think is going to be another vanguard of research that hopefully we can get to very shortly.
This was lovely. I really appreciate your time. Great interview. We got a lot done, uncovered, and I think that our community is better for it.
Thank you so much for the opportunity.
Thank you so much for listening to this episode of Talking Head Pain, the podcast that confronts head pain head on. If you like this episode, please give it an honest 5-star rating and subscribe so you never miss another one. I'm Joe Coe, and I will see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.